Hi, I'm Dave Lewis with Cascade Wellness Technologies and the makers of VORTEQ. I'm here today to introduce Loren James. Loren, thanks for coming. How are you?
Doing a lot better.
Yeah. I wanted to share Loren's story with you. It's pretty amazing. I saw Loren come to church about four days after your surgery, I believe, and I saw you walk in the door, and I was just amazed. First of all, the scar looked amazing. He was walking unassisted, and so I went up to him and said something, and since then I've had a chance to see him walking around Costco and generally misbehaving in a very short period of time. How long was it till you were up and about after your surgery?
Well, of course, they get you up as soon as it's over, but, you know, I dumped the walkers within a week.
Okay, and this was a total knee replacement,
Yes.
is that correct? Okay. And what did they do in the hospital did they put ice on it first? Did they?
They put the ice machine on there and sent me home with the ice machine, but in my opinion, all that does is make it cold and take care of some of the swelling.
Yeah. So when you got home, we brought you a VORTEQ to try, is that correct?
That's right.
Great. Well, tell me about your experience with VORTEQ, and how long has it been since your surgery now? It's been 2 weeks or?
About 16 days now.
16 days?
Yeah.
Okay. And how are you feeling now?
Good.
Good. Well, so when you got home, you didn't continue with the ice.
No, as soon as you guys showed up with the good machine,
The good one's like this one?
I started using that, and I've been using it. And the thing that I like the most about it is that if my knee's hurting a little bit, I can sit down with that and put that on there, and within probably 3 or 4 cycles, the pain's gone.
Wow. So have you used pain meds since you came home?
Well, yeah, some, but I've been trying to. Tylenol's all I've really been using.
Okay. So what kind of a temperature regimen things did you set up on the machine? Now you did this all yourself, or does your wife Ellen do that for you?
Rich came over and kind of set it up,
Okay.
and it's been pretty much there. We got it. I think I cycled it up a couple of doing 12 cycles, and
How hot? How cold?
oh, I got 105 and 38.
Okay. What have you noticed? Does it get colder as you use it? Does it get hotter? Does it? Have you noticed?
It's once it gets settled in, it stays pretty much at that temperatures.
Okay. And are you just seated like you are now, or do you sit back?
I sit in my recliner with my toes the height of my nose, and
That sounds fun.
and well, it's a good time to take a nap.
Yeah, great. So have you been back to seeing the doctor?
I saw
And,
PA Tuesday, which was 2 weeks out, and she took the steri strips off and looked at it and says it looks good. And
Yeah. Was she surprised? Did you tell her what you'd been doing?
yeah, we talked about it some, and she said she'd heard about it,
Uh-huh.
and she talked like she needed to know more.
Wow.
So you're on the hook for that
Oh,
one.
that's right. Well, what's her name? That was Dr. Erin.
Well, Erin Fincher did the surgery, and I think she did an excellent job. This was one of her PAs, Jennifer,
Okay.
that I saw in the hospital, and I saw on Tuesday.
Well, we'll make sure we follow up. I was impressed also with just the look of the scar. I've seen a lot of knee replacements, and I think that's the part that stunned me the most when I saw you coming down the aisle. It looked like it was hardly red or anything. It just completely looked wonderful from a healing standpoint.
Right.
Yeah. Your PT, what has Jim said about your physical therapy, like range of motion, those kind of things?
He's been happy with it. I mean, I actually got out of the hospital at about 100 degrees, but that was with pain meds and that kind of thing. But I normally get 90 easily from him. I'm over there.
90 degrees?
Yeah.
Yeah, okay.
But,
Is that unexpected? Is that better than most? Is it?
well, that's the starting goal for everybody apparently, is 90-degree range of motion. So, but it's been doing good.
That's great. Would you recommend this to somebody else? How would you?
I think it's time to dump the the caveman ice machines and go to something new. And
Yeah, yeah. Well, the secret sauce here, which you've already learned about, is the rapid ability to change hot and cold.
mhm.
Changing the blood flow and the movement of blood and lymph and so forth happens kind of physiologically as opposed to cold and compression kind of things.
Yeah.
Any other comments for us or
Well,
questions
you
you
know,
have?
it's just that hot and cold that keeps it, the constant cold just shuts your blood vessels down so they don't flow too well. So drop in a little warmth, and
Yeah. Well, I thank you,
I think
Loren.
it's a great machine.
Oh, thank you. Thanks for your time and for sharing your story.